All right, welcome, ladies and gentlemen, to Mr. Moore Podcast. We got another special guest in the building. Why don't you introduce yourself to the audience out there and what you do?
My name is Laisa. I'm an LPN, a
Oh,
nurse.
cool. That's what's up. What's up? So, how long did you have to go to school for what you're doing right now, and what did you do before you got into nursing, and what made you want to get into that field of saving people and helping people?
I went to school for 13 months. It wasn't 13 consecutive months because, as though we know, life happens. I had a baby, and COVID happened, and It wasn't what I expected, so I kind of stepped back a little bit. Before I wanted to be a nurse, I did a lot of things. I got 7 kids, so I did. I was jack of all trades when it came to taking care of those kids. I did warehouse work. I did cashiering. Did little stuff in the streets. No, I'm just playing.
You good?
I did what I had to do to take care of my kids. Basically, what it boils down to. I've always wanted to be a nurse since I was a little girl, but I didn't follow the right path of being a nurse in the beginning. So
Nobody follows the right path. Nobody. So how does it feel to be helping people or whatnot? So much different from how you grew up or whatnot. So was it anybody in your family that was in the nursing field that drove you to that field?
my mother.
Oh, okay. So she was a nurse too?
No, she's a medical assistant.
Medical assistant. Oh, okay, okay. So you took it a
My
little bit
grandma's a
further.
nurse.
Oh, okay. So it's like a family of healthcare workers, I
Right.
guess. So how does that feel? So do you so what's your bad days and good days when it comes to your field and everything? Long work hours or whatnot?
The most I've worked is 20 hours before.
A day?
Before.
Straight?
Not every day. Not every day. I have worked 20 hours before. When you're a nurse, you don't get to. I mean, they give you a set time to start, set time to finish. But as though we do know, that finish time can fluctuate depending on what's going on.
Jesus Christ. Man. So you got any interesting stories in your field when it comes to nursing that some people may not know about? I mean, things that happen. I know you probably don't want to talk about most of it.
Well, I can talk about it all. Do we have time?
Oh, we got time.
So it's yeah. I mean, it's just it was a lot more than I expected it to be. I thought nurses just chart. I thought they just sit down. You know, they don't do much. That's what I want to do. Kick my feet up. Tell people what to do. It's nothing like that. It is nothing like that. It's a lot of work. You have to pay a lot of attention. You have to pay attention to your workers. You have to pay attention to your patients. And nowadays, since COVID, patient to nurse ratio is not what it's supposed to be. So, do I have a story right now? Not off the top of my head, but I mean, I don't have a story right now. Let me think about it.
Okay. we're gonna come back to that or whatnot. Let me see what else. It's a couple more questions I wanted to ask you about your field or whatnot. I know you said something about COVID-19. So was you already in that field when COVID-19 hit,
Yeah.
or so how did that affect your work and everything? You being at the hospital and everything, and everybody coming down with all these diseases and passing away. Nobody wants to get sick. So how did you navigate through all that?
I got sick. I did get sick. I caught COVID for 21 days. I had a fever for 21 days. That's when it first started. Yes.
Damn,
I was
that's
sick
deep.
in the bed. I mean, people were sliding me food through the doggy door. Like I couldn't see my kids. It was very hard. But it was a lot of hot days. I can say that we had to get suited, stuff on our feet, legs. Like we had to put on the gown, just everything, cover my hair. Oh, I'm looking like this because I just got off work this morning too. So you have to excuse what's going on right now. But I wanted to come round and cut because nurses are not pretty all the time. 9 times out of 10, we look like this. I don't always wear scrubs. Sometimes I do my best work when I am comfortable in what I am in, and then it's cold. But anyway, it was hard. It was hard you get attached to patients, and they die. So that was the hardest part for me, is watching them. Because some of them are like, I don't want to go. I want to see my family, and asking us, are we going to die? And we don't have an answer for that. So it was very hard. It was hard, and going home to my kids, having to strip at the door, having to go through the back door, having to put my clothes in the bag, change in the car. It was hard. A lot of times having this mask on, not being able to breathe 16 hours a day. It was almost like being treated like a stray dog. Not really saying that that's how they treated us, but that's what you had to, that's what you felt like. Because it's like you can't enter into the real hospital. They had a break room just for you. You can't take your mask off. You can't undress out here. You can't really see the public because nobody wanted to catch it. Nobody wanted to get it.
Now, nobody wanted to get it.
No.
I think the whole country was scared. Definitely when they shut down everything, and everything was closing kind of early. Wasn't nothing opening but the gas stations for real. Then the grocery stores. They was running out of milk,
tissue,
paper towels,
bleach.
toilet tissue, all the necessary things that you need in life. A lot of people lost their jobs or whatnot, but then a lot of people have got jobs because a lot of people got into the healthcare field because of the COVID-19 crisis or whatnot. Because I guess they wanted to help people.
Yeah.
Or
A
whatnot.
lot of people gained talent though. A lot of people did stuff during that time that they didn't know that they could do though too. They start making Crocs. They start saying, let me go be a CNA because they still have jobs. They did all type of stuff. I think they kind of just tapped into their inner talents or something. But it was I don't know. It was a struggle for the healthcare field.
I bet it was. It was showing y'all on the news all the time. That's why I thought this would be a pretty important interview because, we appreciate y'all nurses, the RNs, the nurses, the medical assistants, the doctors, all those people they were showing on TV, getting sick, trying to help other people. And, they wouldn't up their pay for some reason. Some of them, they got taken away from their kids or whatnot.
Right.
Because they were spending so much time at work, trying to help everybody else. But they couldn't even help their own family most of the time because, they was around people with so many viruses. They didn't want to take it home.
Right.
Just like you was talking about earlier. So I know that kind of affected you pretty bad. So what about your career? Are you going to go any farther up or are you cool right now?
I'm going to continue my career. I'm going to go be a registered nurse. I've already enrolled. Just becoming an LPN was so hard. When I tell you that everything that could happen happened during those 13 months of trying to get my LPN license. My car was broken into twice. My whole life, my car has never been broken into ever.
And that happened at the hospital while you was working?
No, it happened at home. I'm talking about life experiences trying to get, when you're trying to become a nurse. Like, it's not a walk in the park. Trying to become a nurse is very hard.